The government said today that H1N1 flu has caused more than 1,000 deaths, and its spread matches the illness rate normally seen at the peak of the regular flu season. Meanwhile, as lines continued to grow at vaccination centers, Dr. Thomas Frieden, the head of the CDC, got a little exasperated over the questions about the slow production of the vaccine, which is grown in eggs. He was pretty blunt. Even if you yell at them, he said, they don't grow faster. So our senior medical editor, Dr. Richard Besser, is here now, and I want to get to that frustration in a second, but first these numbers. Milestone of 1,000 deaths. Put that in context for us.
Well, normally late April to October is when flu takes a break, and clearly that's not the case this year. What they said, millions of cases across the country, 20,000 hospitalizations, and 1,000 deaths. And we don't know where we are in this pandemic, so clearly this is something serious.
So there's no way to tell from this where this pandemic is going next?
You know, if you look at previous pandemics, they come in waves, and we're in the midst of the second wave. We had a spring wave, we have a fall wave. I think it's likely we'll see another wave in the spring, and we may see more of this next year. So, it is not over.
And you saw Dr. Frieden there get a little frustrated at the complaints and those long lines. Is there anything more right now that the CDC can be doing?
You know, the CDC is frustrated, and they're hearing the frustration around the country. Clearly, they expected that there would be a lot more vaccine now than there is, and that's making them, as prevention specialists, very upset. They don't manufacture vaccine, and they had thought that there would be more around right now. But 11 million doses have gone out, and hopefully that has prevented further illness.
So quickly, when can we expect that anyone who wants the vaccine can get it?
I think the real answer is we don't know. I would think that there would be a lot more vaccine by mid to late November, but there could be hitches along the way. So I don't think anyone can really answer that question.
Okay, Dr. Richard Besser, thanks very much.